Midurethral sling surgery. A video by me, Dr. Sarah Steele. I'm currently a fellow in female pelvic medicine and reconstructive surgery at the joint program between the University of California, Irvine and Kaiser Permanente, Southern California, and I have an interest in patient education. We hope the information in this video adds to your knowledge about the procedure and supports the visit that you are having to discuss the surgery. In this video, we will review who the sling surgery helps, information about the sling surgery, including how the sling works and where and how the sling is placed. To help you know what to expect after sling surgery, we will review the typical recovery after surgery, benefits, and risks of surgery. The midurethral sling surgery treats women with stress urinary incontinence who still have bothersome symptoms after trying non-surgical options. Stress urinary incontinence is the leaking of urine when stress is placed on the bladder during activities like cough, sneeze, laugh, or other physical activity. The sling is not designed to treat leaking of urine associated with the urge to urinate or leaking with the gotta go feeling, referred to as overactive bladder. The sling is also sometimes placed during pelvic organ prolapse surgery to prevent stress urinary incontinence from becoming bothersome after a prolapse is fixed. Next, we will review how the sling works. The urethra is the tube that drains urine from the bladder. The tissue that supports the urethra can become relaxed with age or childbirth. Some women also have a weak urethral sphincter. This leads to leaking of urine during activities like coughing, laughing, or exercising. The sling works by supporting the urethra like a hammock, and over time your tissues will grow into the sling, securing it into place. Next, we will review the sling location and placement. In this drawing, we have the sling mesh itself, we have a bladder catheter, which is placed to drain the bladder, and we have the vagina and groin area. The sling is placed through an incision in the vagina and passed through two small skin sites, either behind the pubic bone or in the groin area. It is placed underneath the urethra to help support it. Dissolvable stitches or skin glue are used to close the vagina and the skin sites, and the mesh is cut at the skin itself. If you are having the sling surgery on its own, you will usually go home on the same day as your surgery. If you are having the surgery as part of another operation, your surgeon may keep you in the hospital overnight. Post-operatively, we will perform a bladder test to make sure that you can urinate well. Some women are unable to urinate well after sling surgery and need a bladder catheter for a few days after surgery. Generally, women feel well a few days after sling surgery and can return to work or light activity. There are some post-operative restrictions for 6 weeks after surgery, including nothing in the vagina and no heavy lifting or vigorous exercise. Next, we will review the benefits of sling surgery. The midurethral sling surgery is the most popular surgery for stress urinary incontinence, and it has demonstrated success over the short and long term. About 80 to 90% of women, or 4 in 5, report cure or feel that their stress incontinence is much better after the sling surgery. In studies that have been done to date, this high success rate continues for at least 10 years after surgery. Most women do not need another procedure for this kind of urine leakage after the sling surgery. This is an example of the type of mesh that can be used for the sling. It's important to remember that the mesh is permanent, meaning that it does not dissolve over time. One way to think about it is that your tissue grows into the sling like a plant growing into a support structure. The midurethral sling is one of the most extensively studied surgical treatments for stress urinary incontinence. Like it does with all medical implants, the U.S. Food and Drug Administration, or FDA, reviews the sling material for safety and efficacy. The FDA wrote a piece specifically about using the surgical mesh for the midurethral sling, in which they say the safety and effectiveness of multi-incision slings is well established in clinical trials that follow patients for up to 1 year. Most women do well during and after sling surgery. We would like to review the risks of surgery to prepare you in case they should happen. As with any surgery, there are small risks of anesthesia and of the surgery itself. This is not intended to be a complete list of all possible risks, but a review of the most common risks after sling surgery and of those that are unique to the midurethral sling surgery. You will have a chance on the day of your surgery to speak with your anesthesiologist to ask them any questions that you might have. In surgery, with the midurethral sling placement, there is a chance of injuring the vagina, bladder, or urethra. For this reason, we'll look inside the bladder during what's called a cystoscopy to make sure that there's no injury to the bladder or urethra. There's a small risk of bleeding with this surgery, but less than 1% of patients require a blood transfusion. After midurethral sling surgery, some women, about 20% or 1 in 5, will have difficulty urinating and will need a bladder catheter for 1 to 3 days. Very rarely, about 1% of the time, some women need the sling cut or loosened after surgery if they are unable to void after surgery. There is also a risk of urinary tract infection or UTI after surgery, so if you feel that you have a urinary tract infection, please be sure to call the office. There's a risk of pain after surgery, but most women's pain can be controlled with over-the-counter medication like acetaminophen or ibuprofen. There is also a risk of continued stress urinary incontinence or worsening overactive bladder symptoms, like the feeling that you've got to go. For these reasons, we'll be sure to ask you about these symptoms at your follow-up visits. Next, we would like to review the risks of an implanted sling material. Again, it's important to remember that the mesh is permanent, but your tissues are not. So there's about a 3% risk of the sling coming into the vagina over time. Often this can be treated with a cream, but sometimes a woman needs to return to the operating room to have a part of or the whole sling removed. And like with many implants, there is a small risk, about 1% of chronic pain. Although it is not likely that you will experience one of these outcomes, we think that if you know what might happen, you'll be better prepared. Overall, the goal of sling surgery is to help you return to activities that may be limited by your leakage of urine, and about 85% of women consider their surgery to be a success. In summary, many women have been helped with the midurethral sling surgery. It is a safe and effective surgical treatment for women with stress urinary incontinence. It is important to remember that the sling material is permanent, and you can always ask your surgeon and their team any questions. Thank you for watching this video and for trusting us with your health.